I am a clinical psychologist. I'm in the developmental area, and I'm also a clinical child psychologist. So I wanted to give you a bit of a flavor of the way in which concepts in developmental psychology can inform clinical practice and the kinds of things that we use this information for to help children that are having difficulties. So the name of my talk is What Can Research Teach Us About Anxiety Disorders in Children? And these are a group of children that I also treat in my clinical practice and in my research studies. So I'm going to start from the sublime to the ridiculous, and I'll begin with a child's book for you. And this is a story of Wemberly Worried. And this is a wonderful book by Kevin Henkes that I often use with children. So to begin, Wemberly worried about everything. Big things. I wanted to make sure you were still here. Little things, the classic spilled milk, and things in between. But what if I shrink? Wemberly worried in the morning, she worried at night, and she worried throughout the day. At the playground, Wemberly worried about the chains on the swings, and the bolts on the slide, and the bars on the jungle gym. Too rusty, too loose, too high. And always she worried about her doll Pedal. Shouldn't Pedal be in the car seat too? Pedal's lost forever. I found her, sweetie. I will wait for you. Okay. So how many people think that Wemberly has difficulty with worries? Anybody think that Wemberly's problems maybe exceed what is typical for kids, what's normal for kids? Yeah, that's like a show of hands. Who would be worried about Wemberly? Okay, easy. Okay, so Wemberly actually is a child who we would be a bit concerned about because she does worry excessively. She worries more than is typical, and the kind of worries that Wemberly have interfere with her doing the things she could and should be doing for her age, the things that other children her age are able to have fun, relax, and do. And so I wanted to talk a little bit about worries, the nature of worries, and the kinds of things that we've learned from research in developmental psychology and in clinical psychology to help us help children that have these difficulties. So I want to talk just very, very briefly about anxiety and what anxiety is about. And I can tell you it's a complicated thing. And there are three different aspects of fear or anxiety. And one is the physical part. So, for example, people have physical reactions to things that they fear or feel anxious about. Their heart beats quickly, their muscles get tight, they have lots of energy. So if a great big tiger was to run through here, we would all feel changes in our bodies that would help us get out of the way so that we don't become dinner for a tiger. And those changes are actually the reason why we're still here, why we didn't get eaten long ago, our ancestors didn't get eaten in the jungle, and why we're still here. But that kind of reaction can be problematic if it's occurring when there isn't real danger. Okay, so there's always a physical piece. There's a cognitive piece, and the cognitive piece has to do with thoughts. And those thoughts have to do with expecting bad things to happen, expecting always bad things to happen, and thinking that you actually don't have the skills to cope with things when they do go wrong. So those thoughts are a very important part of anxiety. And the final part is behavioral. And usually the behavior I'm talking about is escaping, getting out of there. So if you think something bad's going to happen, you don't think you can do anything about it to stop it, you're going to avoid it. So the classic thing with children would be, for example, if a child's afraid of dogs and they see a dog, they're going to feel their heart will beat fast, their breathing, gets tight, their muscles are tight. They think, oh no, that dog's going to eat me for sure, and the thing they do is they turn around and leave, and those behavioral things keep this whole system intact and working. Okay, make it more difficult for them to face the dog next time they come along. Okay, so anxiety in childhood. Well, the first question we have as developmental psychologists is, what do we know about normal fears in children, and what discriminates normal fear in childhood from worries that are worth worrying about? Okay, so it is normal for children to feel fear. In fact, it's developmentally appropriate for them. If you take babies, normally developing, newborns to 6 months old, they'll have certain innate fears. One is falling, right? And we can actually demonstrate this when children are beginning to crawl. They've had no experience with falling off of high objects, but we have in developmental psychology, there's some famous experiments where they've constructed what they call a visual cliff, where you put glass over a table and it looks like there's a drop there. We don't usually drop babies in developmental psychology. We don't like to hurt them. But the babies will innately, no one's told them to do this, they'll turn away from that cliff because they know that's dangerous, it signals danger, and they feel fear, and that's appropriate for them. The other thing that babies learn very quickly is fear of strangers. And if you've had children yourself, have been around children, you know that a child that would be delighted to see a stranger at the grocery store, a month later, when they're about 8 months old, all of a sudden it's not fun anymore, they're crying and they're afraid of the stranger. Again, that's a signal that the child's developing normally. They're discriminating known from unknown people. So there's lots of normal fears in childhood. And these things can be quite disconcerting for parents, but they're transitional and they're normal. So what really lets us know that this is a fear worth paying attention to? Well, one of the things is that the fear, as I mentioned with poor Wembley, stops the child from doing things that they could or should be doing for their age. So it's significantly disrupting the child's development in some way. Also causes more distress for the child and is difficult to control. So it's something that a child, let's say a worrying child like Wemberley, goes to bed and can't put those worries to bed, can't leave it alone, okay? And the other discriminator that we have is the intensity or how long-lasting a particular fear or worry is. It's not unusual for children, for example, when they're going through toilet training, to be pretty convinced that something pretty awful is going to happen if they sit on that place that adults want them to sit on. Something, you know, they could fall in, they could shrink and fall down the hole and lots of things. That's completely normal and typical, but not so usual in a 6-year-old. Okay, or a 7-year-old or an 8-year-old. So at a certain age or a length of time, that would be more unusual. Okay, whoops, this looks kind of odd actually. So what are the causes of anxiety disorders in kids? And what has research taught us about this? Well, one area that there's been a lot of research on is genetics. And we know that a certain proportion of anxiety is probably inherited, so about 30% of what we know about anxiety is probably runs in families, and there's lots of very good studies looking at twins, for example, and shared family variants. But we know, just like money, anxiety runs in families, but it's not all due to genetics. Okay, there's other things that happen. So there are neurobiological influences as well. We know that individuals have, there's certain brain regions that are specifically likely to respond to danger cues or threat cues. And in some individuals, these are more active than for other people. There's a lower threshold, if you will, to respond. So I talked about the tiger coming in. For somebody else, it might not take that. It may take the fan becoming squeaky and wondering, what is that about? What's happening? And they're more likely to get anxious. Okay? So we all feel anxiety, but for some people, they're kind of wired so they're more sensitive. The other factor that's related to these other two factors in some ways is child temperament. And that's the one that we've been looking at in my lab at Simon Fraser University, so I'll talk a bit more about that. And finally, family influences, because families and interaction is very, very important to developing children, important for children that develop that are anxious and those that are not. And families can also be extremely helpful to children that have difficulties. And so that's an important area. So I want to talk very briefly about inhibited and uninhibited children. And this comes out of the work by a researcher, Jerome Kagan, who looked at children and realized that even from the time they are newborns, looking at children in a nursery, you can see that they're not all the same. They react differently. Some are just kind of chilling under the lights. They're relaxed. They look like nothing bothers them. A nurse comes in, drops a tray, and they barely react. And other infants look much more agitated, much more reactive, much more irritable. And Kagan looked at those children and sort of studied them over the course of his career and followed them over development, was able to say that there are, in fact, different temperaments that are to some extent inborn. And he started by describing one group of children, the uninhibited children. So this is about a quarter to a little bit more of children born in North America would be described as uninhibited. And these are children that have a variety of personality characteristics. But I can say that from the very beginning, they seem to be the more easygoing of kids. They don't get upset. Temperament is really about how you react to new or unexpected kinds of events. And so for Kagan, this group of kids really seem to enjoy new events. We're pretty much undisturbed by it. These are kind of like your relaxed, laid-back California-type kids, okay? And these are the uninhibited kids. So Kagan was able to say from the time they were babies, new and unexpected experiences just seemed to be fine. And if you imagine a jack-in-the-box and you're cranking it up and it pops up, these are the kids that burst out laughing and want you to do it one more time, okay? So we've all seen these kids. So there's another group of kids that Kagan identified as well called the inhibited kids, or behavioral inhibition. And this was a group 15 to 20% of North American children who did not find new or unexpected events pleasurable. They were, in fact, disturbed by them. So novelty causes distress in these children for the most part. So as infants, they would be more irritable. As young toddlers, they'd be more shy and fearful, and then be more cautious and introverted as children. So these are children that don't think that new events are particularly fun or entertaining, okay? So you don't want to surprise these children. You don't want to spring something new on them. Now, what we know from research following these children in time is that they are, in fact, more vulnerable or more likely to developing anxiety disorders than are this other extreme group, the uninhibited children, okay? But that is not a one-to-one relationship by any means. So just because a child is inhibited when they're a baby means that they are more likely to develop anxiety difficulties, but it doesn't mean that they will. And there's lots that occur over the course of their life that mean that they may or may not. Okay? So that's where we have the role of the family, of learning, of life experiences, and lots of other things I'm going to talk a bit more about. But we know that in this particular way, there are certain characteristics of children that make them more vulnerable. And so in my lab at Simon Fraser University, what I and my graduate students are interested in doing is understanding what are the mechanisms? What is it that makes these children more likely to have difficulty with anxiety? Okay? So we want to know why it is that these children with behavioral inhibition are more likely to develop problems with anxiety. We want to know how behavioral inhibition affects children's understanding of feelings and emotions, and whether or not that may be a contributor. We also want to know whether they pay attention to certain kinds of things in a way that makes them more vulnerable. One of the things we know for adults, for example, or older children that have problems with anxiety, is that they are much more likely to attend to things that might be dangerous or threatening in the environment. And so we want to know if, in fact, these children with behavioral inhibition also do that. If they do what's called being selectively attentive for danger clues. And the best way to think about this is, for example, if you have a spider phobia, and I bet there's at least one person in this audience, probably a female person that does. A few people are squirming, okay. If you have a spider phobia, one of the things that you would be attentive to, for example, if this was a white wall and you saw dots, you might be more likely to see the dots than someone else because the dots might be spiders, okay? And if I told you that, you know, I just had a jar of spiders and they escaped and don't worry about it, my guess is you won't not worry about it. And in fact, you'll spend a lot of my talk looking to see if you're the one that sees the spiders that escaped, right? So we know attention is different. When people have anxiety, it heightens their attention, and they're more likely to be using their attentional system to look for cues of danger. So we want to know if these children do the same thing. And then finally, we want to know what role families play, because as I mentioned earlier, families are the medium through which all children grow and develop. And so families are very important to understand. So in some of our research, for example, because we're developmental psychologists, we do things with puppets and games and stories, and it's not all white lab coats and, you know, making notes. We have more fun than that. So one of my grad students, Dagmar Bernstein, has just completed her doctoral research looking at children with behavioral inhibition, how they understand and identify emotion, and how parent-child interaction and talking about feelings helps children develop that understanding. And she has found that, in fact, children with behavioral inhibition are able to recognize just sort of these phases that I'm showing you here. We use just to label emotion. They could do that fine. But when asked about emotions that a child would feel in certain circumstances, they have more difficulty with that. It's more subtle, and they have more difficulty than children who are not behaviorally inhibited. These are not children with anxiety disorders. These are typically developing children. I should have mentioned in Kagan's work, those children at the either extreme are all normally developing children. They're just different in their temperament, okay? So she has found differences in terms of their processing or their ability to talk about feelings. Another study that I've been involved in, again looking at this attention piece to see if in fact children with behavioral inhibition attend to cues of threat differently, is something called the face in the crowd. So you can see this good-looking guy portrayed 9 times here. And the way that the task would work is that the child would see this array of pictures flash very quickly, not slow like this, and it's like, where's Waldo? Where's the different face? So they'd have to pick that out. And the face changes so that one of those pictures is angry, sad, or happy, or neutral. Okay? So again, this flashes very quickly, and I'm looking to see if children with behavioral inhibition, whether that angry face, because that's a threat, right? If an adult face is angry, that's threatening. It could mean something bad's going to happen. If that pops out at them more so than with other children. And we have similar tasks with something called the dot probe. So this one, they see 2 faces. You can see that the one looks pretty angry, the other one not so much. This would flash. Then the children would see a star on one side or the other. Whoops, sorry, I should go back. And their job would be to catch the star. So we run this study with children as young as 4 years of age, where they would look at the computer screen, those pictures would flash up very quickly, and then the star would be there, and they're to catch the star. And what we have found with another of my graduate students, Arlene Young, has found that children who have behavioral inhibition are faster to catch the star when the face that was shown to them very quickly was an angry face, on the side of the angry face. Again, it happens so quickly, it's not like they're studying the faces, but something about that angry face is drawing their attention in a way different than the children that are not behaviorally inhibited, okay? So we're just building evidence bit by bit, and that's the way science in general, but research in psychology works as well. We sort of look at different ways of studying something that we're interested in, pulling it apart and studying it in these various experiments, and then putting the information together and see what kind of picture we get. Okay, I mentioned as well the role of families. So we have a study that's just completed again in our lab, looking at how parents talk to children and how they participate with children to complete different activities. So from the children's perspective, and this is a father and child participating in the research, they're coming into the lab, they're just having fun, they're playing games, they're hearing stories and telling stories. But what we're really looking at is how certain things that parents do with children might help them sort of bridge to the bigger social world. And despite the fact that they have inhibition and they're more reticent to do that or a little bit shyer, are there certain things parents can do to really help kids make that bridge? And so that's the other aspect of our work. Okay, I mentioned briefly that thinking makes a big difference, and so I wanted just to sort of set a scene for you, if you will, the things that go bump in the night scene. This is something that I talk to children quite a bit about, this kind of thing when I'm working with them in terms of my clinical practice, but also in terms of research. So imagine, if you will, you're a behaviorally inhibited child, and I'm talking to you about this, and say basically you're at your home, it's night, the house is quiet, and everything's dark. And while you're lying in bed, you hear, and you don't know what it is. And then you think, did I hear something? And I listen really carefully, and you hear, what is your thought? What do you think's going on? Any ideas? It could be those spiders, that's right. You could worry about that. If you're a child that was worried about robbers breaking into your house, for example, I would use this with children that have those kinds of fears and worries, like Wembley, can't sleep at night, they're worried. It's maybe robbers are breaking into my house, maybe something awful is going to happen, maybe somebody's breaking in to kidnap me, et cetera, et cetera. So then I would ask the child, how are you feeling right now? So tell me what you're thinking, how are you feeling? And I'm really scared, and I can hardly breathe, my heart is pounding really hard, I'm listening really carefully, my eyes are like open really, really big so I can see in the house. So I get the child to elaborate on that, maybe have the child draw for me a picture of how they're feeling. So this child drew this picture, I am so scared, I don't know what to do. So she's envisioning being in her bed, and this is what's going on in the dark. She can't see it, but she knows it's there. And so this is her thought about what that noise is and what it means and what it's about. Really has to do with those physical and those attentional and those behavioral things, right? And then I say, oh, wait a minute, I forgot one piece of information. That day, you and your mom went out and you got yourself a new kitten. Because it's your new kitten, your mom said, oh, tonight you're allowed to have it in your room. Okay, so you're in the room, it's dark, you hear nothing and you hear, okay, now how do you feel, right? So the thoughts and the assumptions that the child has influence their sort of their feelings and their behavior. So now it's a completely different scenario, right? Unless they're really afraid of kittens, in which case we've got a problem. But for the most time, I check that out before I give this example. Okay. So just speaking briefly about anxiety, I didn't mention that, you know, anxiety disorders, if you have a child that's you're really concerned about anxiety and anxiety disorders, and there's a number of them, a call to, you know, a doctor would be advantageous, because there are lots of really good treatments for kids who have excessive worries and concerns and anxiety. But just to give you a sense of sort of how we understand this in terms of our model, there are, on one hand, things like stressors and innate vulnerabilities that children have to deal with, like inhibited temperament, for example. But there are things that happen in people's lives as well that can be very stressful. And unfortunately, children aren't protected from these things all the time. And so they can have things occur in their life that can sort of weigh the chance of them developing an anxiety disorder. But we know the other side of that scale includes support, things like family support and support from other sources, and learning coping skills, learning ways of dealing with anxiety and anxious feelings and ways of coping, which when children have anxiety, they typically underestimate their skill in coping. And so the last area of this that I'd like to talk about is treatment. So for Wembley, the treatment included, don't worry, said her mother, don't worry, said her father, but Wembley worried, she worried, and worried, and worried. So that form of treatment is applied often. It doesn't seem very effective. Children are often told not to worry. And so we tend to use other means of treating children that have problems with anxiety. And one particular treatment that's been shown to be very effective, Stuart mentioned evidence-based practice. That's where a treatment is held up to rigorous scientific study to determine its efficacy, how well it works. And one treatment for anxiety disorders in children and adults is cognitive behavior therapy. And this really focuses on thinking and teaching coping. And so I gave you an example of when thinking doesn't go quite right, and we know that that's often part of anxiety. And so we teach very actively coping strategies and ways of thinking about things that may help children learn to deal with anxiety. And we also include families. So we do currently have a treatment study that's just about to get started, where we are in fact treating children 5 to 7 years of age for anxiety disorders in groups. And it involves lots of age-appropriate kinds of activities and games, and families are involved as well. So parents would be involved in their own group to help them help their child cope. And so I'm just put this up a little bit to give you a sense of where we go with this kind of research. So understanding the mechanisms that are involved in anxiety from a developmental perspective, and then applying what we've learned from that and from principles in clinical psychology to treat children in an age-appropriate way is really what we're moving to now in my clinic. And so we do have this research study that's beginning. We call it the Treating Sneaky Fears group. And so kids learn about how sneaky fears mess things up and what we can do to fight sneaky fears and to make things better. And so that's where we've moved to. So Wemberly, assuming she's been in the group, she comes out the other end. And the outcome is that Wemberly worried, but not more than usual, and sometimes even less. And she was asked to a sleepover. Before she knew it, it was time to go home. So that's Wemberly's story.
Questions? Right here.
Yeah.
Jenny? Right here. You're live on TV here, all over the internet. Right now. Does that make you nervous?
Nope.
Oh.
I love the camera. When you were saying about the behavior on the physical thing for anxiety,
Yeah.
now I have almost a 2.5-year-old daughter, and she really has no fears. Like, she'll go down our reclining couch head first and think it's hilarious. But at the same time, I was just talking to my girlfriend about that she gets nightmares. Now, does that have to do with anything, like, because,
Your daughter gets nightmares?
yeah, I don't
Okay.
get nightmares.
Does she have early in the night sort of wake up screaming and be very scared, and when you try to comfort her, she doesn't really respond much?
Well, no, like, she'll, like, wake up in little intervals. Like, she'll fall asleep, and then all of a sudden you'll hear, and then it stops. And then another
Okay.
5 minutes later, she'll do it again.
She might be having nightmares, or she might not be. The reason I asked about when she would wake up and sort of, there's a thing called night terrors in children that really has to do less with what we think of. Nightmares have to do with a dream, a really bad dream, right?
Yeah.
And sort of being very scared. And that happens a lot in kids, and that happens a lot, and it's just part of, we all dream, and for children, they probably wake themselves up more. Or it sounds like she's not even waking up, she's just sort of making
she's
noises.
she's like out cold, and then
Right.
all of a sudden she'll like wakes up, and then most of the time when she does get more worked up, it's more, okay, now I gotta check on her, because before she started doing that, or sorry, when she started doing it, I was more like, to every cry, I was like, oh, it's 2 o'clock in the morning, what do you want? Yeah. So I was trying to like figure out, well, what would be causing the nightmares, or her attempts to be, I don't know, freaking herself out, like, because most of the time she'll just get up and then she'll be like, Mommy.
Okay, if they get up and they call for you and they come to you and they know they've had a bad dream, then that probably is a bad dream. And that's really common in childhood. Kids have bad dreams and they don't know how to cope, right? Because they're too little to learn what a dream is and what a dream isn't. At 2.5, she probably doesn't know, so she just wakes up, she's scared, and she needs you to comfort her. But also children can have what's called night terrors, which sounds really startling for adults, and so they can cry out, and then when you go to them, they don't really respond. They're still actually asleep. And night terrors have more to do with transitioning between the different stages of sleep, and may not have any scary content. It just activates the part of the brain, essentially, that looks like extreme terror. So they have those physical symptoms that I described. And so they may be hard to awaken, but again, that's normal. It's just part of transitioning within sleep cycle. And when they're young, their nervous system is still developing. And so if you've ever had the sense when you're going to sleep and all of a sudden you feel like you're falling, it's almost like that for the kids. So it's just that transition while they're sleeping. So it probably doesn't mean much more than she's just learning to regulate things. And it's pretty normal.
Hi, do you have any, have you worked with children with special needs with anxiety as well?
I have.
I was more concerned with having an aversion to certain sounds, and then being fearful of going into areas that there may be a sound that will come, like a buzzer sound or whatnot.
Yes, yeah. Children definitely can have that kind of fear. Any kind of, like a specific phobia can be to almost anything. And it's very idiosyncratic. There are some that are more common than others, like simple animal phobias are more common, but absolutely children can have phobias to very specific things. And when you said children with special needs, if children have other kinds of challenges of one sort or another, they can be more prone to that because, again, they may not have as much ability to sort of, if they have problems with language, kind of reason their way through it, and so they're reacting to it. It's very common for young children to have a fear of noises and loud noises and things like that. So, yeah. One of the sites in the Lower Mainland is in BC Children's Hospital. They have a specific clinic for children with anxiety disorders, which are a good resource, and also the Ministry of Child and Family Development have a number of children's mental health clinics across the mainland that you can find either through the telephone directory or the website. And most definitely children can develop those kinds of things.
One more, right up here.
Is there a difference in severity of anxiety disorders between adults and children? Like, will children suffer more severe symptoms of anxiety disorders?
That's a really good question. Certain kinds of anxiety disorders are more common in adulthood than childhood. So obsessive compulsive disorder, for example, usually doesn't develop until puberty. But in terms of severity, I would say not. In childhood, anxiety disorders can be very debilitating as they can be in adulthood. And so I would say that they can be just as disruptive for children and just as severe. And what we know is that treating children when they're young is helpful because there's a tendency for these things to kind of, they may be different in form, but someone who has anxiety disorder in childhood is more vulnerable for some sort of problems with anxiety in adulthood. So that's why in developmental psychology and clinical child psychology, we really like to focus on understanding how it works in childhood so we can basically make a difference that should have a difference as the person develops as well.